Healthcare can be very confusing. One day something is good, then there's so much information, next day it isn't any good anymore. So very hard to take care of yourself, particularly if you listen to a lot of different people. I'm going to talk about something that's very controversial, which is hormones. Now, why are hormones so controversial? Well, there was a very large study published in 2002, which, in my opinion, overemphasized the risk and underestimated the benefits of hormone therapy. So I'm going to go through some myths and also some misunderstandings about hormones. And the first question, of course, is why do we use hormones at all? Well, for some women, particularly about a third of women who reach 50 will develop a menopausal syndrome. And it's a syndrome. It's not just about hot flashes. You see some of the symptoms listed here, but they include hot flashes, night sweats, insomnia, fatigue, in some cases dizziness, joint pains, vaginal dryness, and there can be mood changes as well. In fact, we know now that the mood changes may be the first sign that menopause is on its way. This is a time at 50 when this occurs, when many women are very busy. They may be at the height of their careers. They may have adolescent children at home. They may have elderly parents to take care of. This is not a good time not to feel well. And it lasts a long time, 2 to 5 years if you're lucky. It may go on longer than that. So it's a time to think about whether the therapy is right for you. As an example, I had a patient who stopped her hormones in 2002 after this study came out. And she fell asleep at the wheel driving, and she had an automobile accident. And she's much worse off now than if she had continued her hormones. I have another patient who's a lawyer, and she got up to do her argument in court, and she had a hot flash. And she started sweating and, mopping her brow and couldn't find her place in her papers and stuff. And she said, everybody thought I'd lost it. And she said, this is not acceptable behavior as a professional. I can't deal with this. I had another patient who was a writer, and she told me, sadly, I've lost my muse. I can't find my muse anymore. So there are times when you need to look at quality of life and decide whether the hormones are appropriate. The mood issue, I think, is very important. And basically, if you're going to lose your sanity, your job, your husband or partner, it's time to think about therapy. So let me talk first about a misconception. The misconception is hormones cause breast cancer. Now, there's never been any scientific proof in people that the hormones cause breast cancer. Yes, the large study that I alluded to that was published in 2002 showed 8 extra cases of breast cancer per 10,000 women per year. 8 per 10,000. That's 0.8 per 1,000, or if you can think of it in terms of percentages, it's 0.0008%. Now, if you remember your fractions, that's a lot less than 1%, right? Yeah, it's a very small number, and it's not the thing that's causing most of our breast cancers. It's a very, very tiny number, and breast cancer, in my opinion, is not caused by the hormones. The oncologists tell us that a small amount of atypical cells may take 5 to 8 years to show up on a mammogram. And we think that the hormones are acting as a growth factor. It's a promoter. It's not a causal effect. And these women who are developing the cancer on the hormones are accelerating the growth of these cells versus the ones who don't have this focus of cells. So it does have a role. And in fact, we do pay attention to the risk factors, but it's really tiny. And if you're talking about 2 to 5 years, it took 5 years in this study for the breast cancer to evolve. So we have 2 to 5 years, basically, in which to think about therapy. For many patients, I do go on longer. Now, I'm going to tell you something I'm sure most of you don't know. This was published this year. It was good news. It received very little publicity. This is the incidence of breast cancer which occurred in this study. And these were women not on estrogen. Okay? The ones who took estrogen had this curve. There was a significantly lower incidence of breast cancer in the woman on estrogen. Now, these are women, this is up to 11 years. Now, these were women on estrogen alone. They weren't taking estrogen and progesterone. Estrogen and progesterone is what you have to take if you have a uterus. Why there's a difference between these two groups, we don't know. But certainly, patients who only have to take estrogen alone should be very reassured that this drug, up to 11 years, shows no incidence of breast cancer increase, and in fact is significantly lower. So now I'm turning to myths. A myth, hormones cause heart attacks. Not true. When they actually went back in the study and looked at the women who were under 60 and who were near the age of menopause when they started hormones, less than 10 years, there was no increase in heart attacks. So if you start your hormones at a time of opportunity, when you're having symptoms at the normal age of menopause and up to 10 years after, there is no increase in heart attacks. And in fact, they looked at the calcium in the arteries of these women, because that's an indirect way of determining whether you have heart disease. They looked at estrogen alone, women under 60 who were taking estrogen alone, and they had significantly less calcium than the women who did not take estrogen. So estrogen can, in fact, protect your heart. And this is very important because I see young patients who go through menopause. And it's a very sad thing at 20, 25, 30, many under 40. And they need to take estrogen because they're at higher risk for heart disease. And because of the bad publicity, it's very hard to convince them. But in fact, this will protect the heart if taken at the appropriate time. Another myth, it's perfectly possible to have normal sexual activity without hormones. Not true. The vagina ages and becomes fragile, very similar to the skin as people age. And there are changes which are very difficult for patients wanting to have intercourse. And even some patients who don't have intercourse will have severe dryness and infections. It's very possible to cure this, and you can cure this with local estrogen in the form of a pill, a ring, or a cream. And it's applied locally into the vagina, and very much like a local antibiotic. When you put on a local antibiotic, it doesn't go through the whole body. It just stays in that area and nourishes that area. And the skin of the vagina builds up again, and as long as you stay on the local estrogen, it can improve things tremendously. And in fact, many of our oncologists now do allow their patients who have had breast cancer to use local vaginal estrogen. Okay, the last myth has to do with bioidentical hormones. The myth is that bioidentical hormones are safer. Not true. Now, what are bioidentical hormones? Well, the definition is really the hormones that you make in the body, the same hormones, okay? And we have some very good ones on the market that are regulated and tested. But the marketing has made this distortion, so people think that bioidentical hormones are only the ones made up in pharmacies. Now, the pharmacists can make up bioidentical hormones. They have access to the same raw products, but it's the same thing that is regulated and tested. The problem with making up hormones in the pharmacy is that there's no quality control. So sometimes it can be very difficult if patients have side effects. You don't know exactly the dose that they're getting. So all of bioidentical hormones probably have the same risks, whether they're regulated or tested or not. And the big difference between hormones are, in fact, the ones that you put on the skin and the ones you take by mouth. There are differences. The ones you take by mouth cause changes in the liver, which increase clotting factors and increases a bad fatty lipid in the blood called triglyceride, which is a risk factor for women for heart disease. But it does good things as well. If you take it by mouth, your HDL will go up. And that's good cholesterol, and it protects you from heart disease. On the other hand, the hormones that you put through the skin that get into the bloodstream directly don't increase clotting factors, don't increase triglycerides, but they don't increase HDL either. So it's a question of what's best for you. And my feeling is unfortunately, I'm seeing a generation of women that are suffering because they're afraid to take hormones. So my view is that you should live long, live well, and die quickly. Thank you.